Hi, now again I am continuing the cancer awareness program, and today I am going to discuss about ovarian cancer because this month is the month of ovarian cancer month, that is September month. So what is cancer? These things I have already introduced. Cancer is the uncontrolled growth and spread of abnormal cells in the body. These cells can form tumors, invade nearby tissues, and spread to the other organs, that is metastasis. More than 100 types of cancer exist, classified by the organ or cell type of origin. Now, different types of cancer: ovarian cancer, breast cancer, lung cancer, pancreatic cancer, colorectal cancer, and many more. Importance of cancer awareness: it promotes early detection and timely treatment, reduces stigma associated with cancer diagnosis. It encourages funding and support for research and patients, empowers individuals with knowledge about prevention and symptoms. Now, there are some color code also. For example, today we are going to discuss about the cancer that is ovarian cancer, which has the color of this color, that is teal color. So this is ovarian cancer. And then there are different colors are for different cancers, but there are some similar colors also. Now, what I mean here, this is the September month where you can see ovarian cancer is also in the month of September. So this month is celebrated. This month is meant for the awareness of ovarian cancer also, and this is the basically you can call as September as ovarian cancer awareness month. Now, what are the preventions and early detections? These things you need to understand. And for this purpose, I started the basic definition of ovarian cancer. Ovarian cancer is a disease in which, depending on the type and stage of the disease, that is malignant cancerous cells are found inside, near or on the outer layer of the ovaries. An ovary is one of the two small almond-shaped organs located on each side of uterus that store eggs or germ cells and produce female hormones, estrogen and progesterone. Now, if you want to see the structure or figure of ovarian cancer and some different locations for this ovarian system. So for example, here you can see this vagina, then cervix, then cervical canal, myometrium, endometrium, cancerous ovary, then here normal ovary. You can see the difference between cancerous and normal ovary, then fimbriae, fallopian tube, fundus, cavity of uterus. These names you can see. So basically, there are the possibility to have the cancerous cells in different sub regions of the ovaries. Now, our ovarian system. So here, what you need to understand, so depending on the location of the cancer, the prevention or diagnostic intervention becomes complicated. Now, the common types of ovarian cancer: epithelial tumors, that starts from the cells that cover the outer surface of the ovary. Most ovarian tumors are epithelial cell tumors. Germ cell tumors start from the cells that produce the eggs or ova, occur in young women. Stromal tumors start from the structural tissue cells that hold the ovary together and produce the female hormones, that is estrogen and progesterone. Now, three these three types of ovarian cancer you can see here. For example, this is epithelial cell, then stromal cell, then germ cell cancer. So the three different and most common types of ovarian cancer based on subtypes of these cells. Now, these three types of ovarian tumor, for example, epithelial tumors are serous, clear cell, endometrioid, mucinous, transitional cell. Stromal cells, fibroma, granulosa cell, steroid, Sertoli cell, Sertoli lady cell, then T coma, and then germ cell tumors. That is here choriocarcinoma, dysgerminoma, then embryonal carcinoma, then teratoma, and then yolk sac. Now, if you want to see these three major type of cancer, ovarian cancers, then here you can see epithelial cell layer, then germ cell, then stromal cells. Now, the now there are clinically, if you are talking, then there are type 1 and type 2 ovarian cancer. In type 1 ovarian cancer, the histological subtypes are low-grade serous carcinoma, mucinous carcinoma, endometrioid carcinoma, clear cell carcinoma. And the clinical features are slow growing, less aggressive clinical presentation, and can be diagnosed at early stages of the disease, like stage 1 to 3. Then molecular profiles characterized by genetic stability. Common mutated genes include PTEN, BRAF, KRAS, CTNNB1, and PIK3CA. Then type 2, this is histological subtypes. Here, high-grade serous carcinoma, HGSOC, carcinosarcoma, mixed mesodermal. Then undifferentiated carcinomas, and clinical features are rapidly growing, more aggressive clinical presentation, mostly diagnosed at advanced stages of the disease like 3 to 4. And molecular profiles include high genetic instability, TP53, CCNE1 mutations are very common. Pathogenic germline BRCA1 and 2 mutations are present. Now, the stages of ovarian cancers are 1, 2, 3, and 4. Cancer in stage 1, cancer is found in one or both the ovaries. In stage 2, cancer has spread to other parts of the pelvis. Now, cancer in stage 3, cancer has spread to the abdomen also. In stage 4, cancer is found outside the abdomen. Now, these stages can be represented in terms of picture, the same thing as I mentioned, that healthy ovaries you can see here, and here cancer is confined to one or both the ovaries, either here or here. Then here in stage 2, cancer spreads within the pelvic region. Okay. And then next part, average in stage 3, average stage of diagnosis. This is stage 3. That is stage 3C. Cancer spreads to other parts of within the abdomen. Now, here you can see in stage 4, cancer spreads beyond the abdomen to other body parts. Now, the same thing could be seen in a clear pictorial view, like here, stage 1, cancer is found in one or both the ovaries. Okay. Then these red cells are basically representing the cancer, ovarian. Then stage 2, cancer cells have spread from ovaries to other parts. So other parts, from here to other parts. Then stage 3, cancer cells have spread outside the pelvis region. And then you can see where are their locations. Now, in stage 4, the cancer has spread beyond the abdomen, such as the lungs and spleens. That those things you can see here. Now, ovarian cancers, if you summarize in one picture, like the cancer types, and then second type 1 and type 2, as I discussed, so they can be summarized here, the three types as well as these two subtypes. Now, signs and symptoms. This is very important, which is required for cancer awareness. For example, what are the possible signs and symptoms? So, abdominal bloating, pressure, and pain could be observed if someone has cancer. Then, abnormal fullness after eating. So even if you are eating less or more, you feel something very abnormal, difficulty in eating. Then an increased urge to urinate. So there is more frequent urination. This is also one of the signs. What are the other symptoms? These are the four common symptoms. There are other symptoms, fatigue, and these are common symptoms for many other cancers also. Indigestion, heartburn, constipation, back pain, menstrual irregularities, painful intercourse. Now, the same thing you can see. What are the ovarian cancer symptoms? Bloating, difficulty in eating, pelvic or abdominal pain, frequent urination, feeling full of small meals, vaginal discharge, irregular vaginal bleeding, postcoital vaginal bleeding. Now, how is ovarian cancer diagnosis done? So, there are clinical examination, pap smear, imaging tests. Now, you can also summarize those symptoms. For example, back pain, pain during sex, unusual belly swelling, then extreme tiredness, acid reflux, menstrual changes, weight loss, constipation, or upset stomach. So now, after you know the symptoms of ovarian cancer, you can basically, there are 5 6 points which you need to keep in your mind always in order to get aware. So before you develop such diseases, you could identify what is happening and you can contact the doctor at the right moment before it is too late. So, for that purpose, this is the list which you need to keep in your mind. Abnormal bleeding, being more frequently, loss of appetite, consistent bloating, pelvic and or back pain, tiredness more often and fatigue more often, changes in bowel habits and pain during sex. Now, the grades, different grades of ovarian cancer, which you in general could observe in the medical report. For example, GX, the grade cannot be evaluated. GB. The tissue is considered borderline cancerous. This is commonly called low malignant potential or LMP. G1, the tissue is well differentiated tissue. Here we are talking about the cancer tissue. Contains mainly healthy looking cells. Then G2, the tissue is moderately differentiated. More cells appear abnormal than healthy. G3 to G4, the tissue is poorly differentiated or undifferentiated, and more cells appear abnormal and lack of normal tissue structures are present. Now, the same thing could be subclassified. So, the ovarian cancer could be divided into sub-stages. For example, stage 1 could be divided into 1, 1A, 1B, 1C. 1 means limited to ovaries or confined to one or first or second ovary. 1A means one ovary, 1B means both the ovaries. 1C, ruptured capsules, surface tumor, or positive peritoneal washings and or ascites are present. And this is the survival rate here is 75 to 90% in stage 1. But when you go to a stage 2, which has again four subclasses limited to pelvis, uterus, tubes, and other pelvic structures, the above plus positive peritoneal washings and ascites. And survival rate, 5 year survival rate is for 45 to 60% of the patients. Now, again, you can go to stage 3, 3A, 3B, and 3C. Here, 3 is limited to abdomen, 3A, microscopic metastasis, and macroscopic metastasis that is less than 2 centimeter could be observed in 3B, and in 3C, macroscopic metastasis greater than 2 centimeter and regional lymph nodes are present. Now, stage 4, distant metastasis outside abdominal cavity. And here you could see the lowest survival 5 year survival rate. Now, the cancer grades could be also summarized into a circular chart. For example, GX, the grade cannot be evaluated or determined. The GB, borderline cancerous. G1, tumors have more healthy appearing cells. G2, tumors have more abnormal appearing cells than healthy. G3 and G4 tumor appears abnormal and lack normal cell structure. So then, if you want to go for the clinical type and subtypes, then you can understand these ovarian cancer. So ovarian carcinogenesis, type 1, endometriosis, fallopian tube, germ cell, transitional cell, and type 2 is here in fallopian tube, where HG serous carcinoma is there. And then it is usual type, set type, immunoreactive subtype, proliferative type, differentiated type, mesenchymal type, carcinosarcoma, undifferentiated carcinomas. And then here, if you understand endometriosis, endometrioid carcinoma, clear cell carcinoma, seromucinous carcinoma, and then in this way you can understand the clinical types of ovarian carcinogenesis. Now, what are the risk factors for ovarian cancer? Age for less than 12 years and higher than equal to 50 years. Inherited gene mutations are BRCA1 and 2. Estrogen hormone replacement therapy, age when menstruation started and ended, never being pregnant, so nulliparity, and then fertility treatment, then smoking, family history, polycystic ovarian syndrome, pelvic inflammatory disease, endometriosis. These are the risk factors, and the same risk factors have been presented in the right side uh, drawing, where you can see they know never given birth, history of miscarriage. This is also one of the risk factor. No breastfeeding before, excessive use of assisted reproductive therapies. Then age greater than 63 years old, obesity, history of polycystic ovaries or breast cancer, menopause of an older age, had used hormonal replacement therapy. Then family history of ovarian or breast cancer, inherited BRCA1 and BRCA2 genes. Now, the risk factors in increased risk and decreased risk can be classified in two groups. In terms of increased risk for ovarian cancer, increased age, family history of cancer, hereditary cancer of syndromes, obesity, having never given birth, hormone replacement therapy, increased number of lifetime ovulatory cycles. Now, decreased risks, bilateral salpingo oophorectomy, then oophorectomy, bilateral salpingectomy with ovarian retention, hysterectomy, tubular ligation, use of oral contraceptives, and breastfeeding. Now, these risk factors could be more summarized. For example, increased risk, family history, genetic mutations, postmenopausal, and increased age. Decreased risk, pregnancy, breastfeeding, use of oral contraceptives. Diagnosis based on medical history, pelvic examination, imaging tests such as ultrasound, CT scan, MRIs, blood test which can detect a protein, chest X-ray, biopsy, positron emission tomography scan, or PET scanning. And these things can be summarized. So, five facts which you need to know about the ovarian cancer. Pap test does not detect ovarian cancer. Ovarian cancer is often diagnosed at a late stage. Diagnosing ovarian cancer before it spreads makes it much more treatable. Symptoms awareness might lead to a more rapid diagnosis. Common symptoms include persistent bloating, difficult eating, and feeling full quickly, pelvic and abdominal pain, urinary symptoms. Now, how is ovarian cancer diagnosed? So, there are a number of diagnostic approaches. For example, here, transvaginal ultrasound, OVA1, computerized tomography or CT scan, CA125. And then surgery is the only way to definitely diagnose and stage ovarian cancer. So ultimate way of treatment in case of ovarian cancer is surgery. Depending on the situation, surgery may be determined to be unnecessary or may take place earlier in the diagnostic process. Now, treatment surgery is one of the alternate way, but there are certain conditions for surgery to succeed. That means at early stage, but not at the highest stage or grade 4, you are going to go for surgery, which may not help at all. So, his oophorectomy, the surgical removal of one or both the ovaries. Women who have only one ovary removed may still become pregnant. If both the ovaries and fallopian tubes are removed, it is called bilateral salpingo-oophorectomy. Hysterectomy and removal of other tumor that may have spread outside the ovary is done in more advanced ovarian cancer. Once the uterus is removed, a woman is no longer able to become pregnant. Then chemotherapy. This is not that much successful, but it is still used and recommended for women with ovarian cancer after surgery. It is a drug treatment that uses chemicals to kill the fast growing tumor cells. These drugs can be injected into a vein or taken by mouth. The drugs can be injected directly into the abdomen. It can also be used before surgery for advanced cancer to enable the removal of as much of the ovarian cancer cells as possible. Then the stages of ovarian cancer are diagnosis are in late stage. Mostly the people reach there at 60%, early stage 40%, and early stage diagnosis is more successful. Now, prognosis, staging and survival. Like grade 1, 2, and 3 have more possibility, but grade 4 has the least survival chances. And prevention, avoiding certain risk factors, using oral contraceptives, gynecological surgery, and breastfeeding pregnancy. So these are the alternate way of cancer awareness therapy and basic fundamentals of ovarian cancer. So there are list of the chart figures which you can think about, like as it is presented here. Thank you very much. And you also need, in addition, some kind of nursing intervention. For example, every woman needs to be taught about the importance of having routine screenings for cancer of the reproductive system, the risk factors of the reproductive system, menopause signs and symptoms, hormone replacement therapy, manage clients' pain and related to chemotherapy, monitor for infection, teach each client how to prevent it, explain the need of increased intake of fruits and vegetables and whole grains, administer anti-nausea medications as needed, assess patient for body image changes, and then psychotherapy. Thank you very much. Now there is a last question. Is ovarian cancer a silent killer? Yes. One of the most common cancer among the women, not only in Malaysia or in one country, but it is in almost every country. Individuals may not show specific symptoms in the early stages. So, what can increase the risk? Middle aged, then evidence in your family history, obesity, smoking, early menarche or late menopause, then symptoms vaginal bleeding, pelvic or stomach pain, abdominal bloating, frequent urination, loss of appetite, abnormal vaginal discharge. How to potentially reduce the risk? Uses of combined contraceptive pills, having children, breastfeeding, and hysterectomy.